Okay, here's our start of care packet. Excuse me. The first form is the consent form. This is consent for evaluation and treatment. And so you'll see you'll have the client name, their ID number or medical record number. You'll go over this form with the family member, excuse me, you'll go over this form with the parent or the legal guardian. I forgot to say earlier, start of care packets have to be completed in the home where the child lives. And they must be filled out with the parent or a legal guardian. They cannot be completed at a daycare, grandma's house, anything like that. We have to see if their home is safe. And so the start of care packet has to be completed with the parent or the legal guardian in the home where the child resides. The evaluation, once you've got this start of care paperwork filled out, does not have to be done in the home if that becomes an issue, but you do have to go to the house where the child lives and have a parent legal guardian fill this paperwork out with you. Okay, that being said, here's the consent form. So you'll go down here to licensed home health services and you'll put evaluate and treat next to your discipline. If you know there's another discipline coming in after you, then you can also put the evaluate and treat under their initials as well. This little part here, you just kind of go over what it says. And then I've read, understand, and received a copy of all of these forms listed. This is what is in that red book. Sorry, the color might change as new revisions, but the patient information guide or the PIG that you went over that has the dad's phone number and things like that. These are all the forms that we just went over in that booklet. And so you'll talk about this and you'll get down here to advanced directives. And this is the section that you'll fill out. There's advanced directives information in the PIG if they need that. These questions are about the patient, not the parent or the legal guardian. So most of them are going to be no. I made a directive to physical living will, no. Medical power of attorney, that's going to be no. They might have a do not resuscitate order for their child. The next one's going to be no. And then I have requested 211 emergency transportation registration, number 5. So this one, if there is, so this is what I usually tell the families, they have to register for transportation in case of emergency prior to the emergency. So if there's something like a tornado or a flood, they would have to have already registered for transportation to a safe location during that disaster. And all they have to do is call 211. So you tell them, ask them if they need transportation in a case of some kind of disaster emergency. And if they do, then they need to call 211 and register for that transportation before the disaster occurs. So they just have to call that number and the operator will help them with that process with registering for that transportation. The next one, consent for photograph or my medical record. We do not take pictures and put them in the medical records. So we like them to pick yes, and so we try to make them feel comfortable. This will not be used for solicitation or websites for advertising. It's just going to be used for the purposes of maybe you making a visual schedule, maybe making a communication book, or if you and the parent or you and an assistant want to take videos and pictures, send them back and forth to find out what's going on or to do some type of supervision, things like that. And then in that case, you would need the consent for that photograph. So you'll want to talk to them about that. The next one, number 7, triage level. So triage level is in an emergency, do they need triage? So do they need someone to come see them? Do they need life supporting equipment that's not working because there's no electricity, things like that. So it is based on whoever their nurse is through, whatever company their nurse is through. So level 4 green is therapy only. No one's going to go out and do therapy if there's some kind of emergency or disaster. So that would be level 4 green therapy. Or therapy only, or therapy with nursing from a different company other than at-home healthcare. So if they have nursing with at-home healthcare, then we have to pick the triage level that our nurse put on her paperwork. So therapy only, level 4 green. Therapy with nursing from a different company, level 4 green. Nursing with at-home healthcare, you'll put what their nurse put, what our nurse put, excuse me. The next one, you can click on I choose to be the designee or I do not. If they click I choose, you need to put their name over here in designee. That just means they are going to provide services or take care of their child when you're not there. Either one of those choices is fine. Patient signature, the patient never signs. It's always going to be a parent or legal guardian. So you'll put minor there and date it. The parent or legal guardian is going to sign here. They're going to print and put their relationship, and you're going to sign it with your credentials and date it. So make sure you date it and they date it, and you sign with your credentials. And they print their name and their relationship and sign there. Translator information if you use one. Financial policy, very important document. Make sure you get this filled out correctly. Just kind of go over it. They have Medicaid. They're not responsible. So you'll just have them initial. This initial, just explain to them that they're initialing that they're receiving this information. It's not that they are obviously responsible, but Medicaid is going to be paying their bills, not them. And so you're just informing them of what the policy is. That's what they're initialing here. Termination of agreement, and they'll initial and put the date, excuse me. Patient name, and then this is still the financial statement. Make sure you fill out every section of the financial statement. We have to have this. If you don't fill it out correctly, they will send you back out to fill this out. And so it's going to be Medicaid, usually not Medicare. Sometimes they have both. That's fine. You'll put both. Did you see the card or not? Medicaid number. The policyholder insured name. Usually it's the client. Their date of birth, their policy number, self, relationship. You do not have to get a social security number from of the child. You can put parent refused or something like that in this blank. Mailing their address and their phone number. Responsible party name, date of birth, address, phone number, relationship, their social security number or driver's license, and email address if they have one. You could also get another name and phone number, like a dad or a mom or somebody else. And then you'll just go over these little sections and have them initial those. Down here, very important, make sure they initial that they want to be placed on hold. This will be like while they're waiting on authorization from the payer, or if they're Medicaid terms and they're waiting for that to become active again, they're going to want to be put on hold. So while we're waiting off, we'll put them on hold. As soon as we get authorization, we will begin services again. If they turn for Medicaid, we'll put them on hold until that's active. And so they won't be responsible for any treatment, paying for any treatments. We'll wait until we get that authorization. Signature, date, patient information sheet, patient name, patient ID, alternate service plan. That's just an alternative alternate caregiver, like a dad or an uncle, aunt, grandma, whoever else can take care of the child if the mom's not there or whoever's not there, and someone else who can sign the visit notes each time. So you'll put their name and number there, and then they'll click the next box and initial it that they they agree to provide services if at-home healthcare is unable to provide services. So basically that they're going to take care of their child, or they're going to perform home education or homework when we're not there. And then there's the triage level again, level 4 green, therapy only, or therapy with the nursing from a different company. Ask them about their emergency plans. How many exits do you have? Are their exits clear? So usually I'll say they have 4 exits, and I'll name them garage, back door, side door, front door. Front and back exits are clear. So this example does not show that, but please put that. It's very important. Do they have working smoke detectors? Do they have fire extinguisher? Things like that. And then the section B, you'll complete this on reevaluation. And then they sign it, date it, you sign with credentials and date it. The EVV, you can skip this form. You will not be clocking in on some time clock in a patient's home. This is for nursing. You'll just be checking in and out of your visit notes, but not on a device in their home. Medication profile, so you'll use this. If you cannot enter the medications into CanTime, then you're welcome to use this paper version, but you can enter medications directly into CanTime if you have internet service. This MDCP is basically like the patient information sheet, alternate caregiver. They're going to take care of the child if you're not there. And then you sign it, they sign it, date it. The MDCP form is really just for kids that have, that are labeled MDCP. They're in the program. You will, you should know if they have MDCP or not. If you fill out this form, it is no big deal. It's actually got some really great consent information on there. So go ahead and fill this one out. If the office does not need it, then they will shred it. But it talks about reporting suspected neglect and abuse, that you can complain, things like that. So it's a good form to have filled out. Our promise, so this is where I'll stop and talk about what they can expect from me as a therapist as far as making up visits, communicating with them about their child, communicating about being late or needing to reschedule, things like that. Being timely with those things, and then what we expect from them. If their child is sick, has a fever, they need to be fever-free for 24 hours with no medication. They need to be diarrhea-free for 24 hours with no medication. And then if they're hospitalized, they actually are admitted to the hospital. We need to know because we need to resume order from the hospital before we can go out and continue seeing them. And then things like when they need to be available and they need to do makeup visits, how do they want to be contacted, things like that. They can be discharged, they can have their frequency reduced or be discharged from therapy if they're not compliant with home exercise programs or with therapy visits. And then they sign it, you sign it, date, always use your credentials, patient's name, medical record number. Agency to agency transfer. So this one is required on every patient as well. You'll just ask them if they've ever had services before. They don't always know or remember. So make sure you always get this filled out. There is a spot that you can check that says there are no known evaluations or treatments. So go ahead, put the responsible party's name, the patient's name, the date of your evaluation, your discipline or skill, the current provider or the one that they used to have, and effective date of your evaluation. If they don't know the name of the provider, that's okay, we can find out. And then why are they switching? And then if there's no known, you can click that. And then, and especially this one, so there are no known evaluations or treatments in the last 6 months. If they had an evaluation and it's been less than 6 months, insurance will not pay for another evaluation. So you need to let them know, to make sure you know what's going on with that, and then have them sign and date. And that's it for your Start of Care admission packet.